Hey everybody, day 4 of 21. After I posted the video yesterday, I did end up getting called in to work last night. So I went downstairs to receive my assignment around 1:30 yesterday, was told I wasn't going to be working, and then I got a phone call around 4 p.m. saying to be downstairs at 5:45. So a lot of us were like that, so most of us went to work last night unprepared for night shift, meaning I didn't get any sleep, not to work 12 hours. So I am at Coney Island Hospital. It is a 330 something bed hospital, I think, somewhere around there, and they're up to almost 500 patients. I'm in the ICU. So we're running 2 to 3 patients a piece, which isn't bad for an ICU, a lot better than what I was anticipating. Um, we were given our PPE yesterday and worked with a nurse in the area in which we were going to be working. So I went to the ICU. Patients are sick, and the PPE just makes things a lot harder. It takes a lot more out of you than just a normal shift. So where I'm at, we are in bunny suits. So the zip up jumpsuit type things, we have those on all the time. We don't come out of them. And then when we go in a patient's room, on top of that, we put a blue plastic isolation gown that we throw away each time. And then, of course, we are wearing our N95 masks with either a surgical mask or a cloth mask or something like that over it, just to help preserve it longer. Typically, these are masks that we wear once and throw away, not in, not in disaster nursing, not in what we are doing now. We were given one N95 mask. We'll get another one in 5 days. Our bunny suits, they last as long as absolutely possible. We take them off after each shift, put them in a bag, and leave them at work. We're in face shields or goggles, some type of eye protectant in the rooms, and so it's hot. It's always hot. So that just makes it a little bit harder. And then, of course, your patients are really sick again. I will only work if I have PPE that is something our company says, absolutely not. If you don't have the proper PPE, you will not work. One of the big things right now is protecting yourself from exposure. This hospital has several employees that are COVID positive. They have several employees that are patients in the hospital. So, scary thing. And we will, I don't know, I guess I'll let you know more as I see it. Tonight will be my first night with my own assignment, and we will see how things go. I know they are setting an orientation last night. I think the supervisor's pager went off about 11 times from 7:30 to midnight with codes and rapid responses, which is what they call right before the patient codes. And then once I got to the floor, I heard a few more overhead, and they don't page overhead the ER, and I don't think they page overhead the ICU. So that was just out in the floors. I'm an ICU nurse, so I'm used to sick, intubated, drips. I'm used to this. 2 to 3 patients. Sickest of the sick. Got it. The nurses that are out on the telemetry floors, the med-surg floors, they're really the ones. They get on before they crash, while they're crashing. They are having to deal with patients that they're not used to taking care of. They have ventilators out on some of these telemetry floors. It's just, kind of learning on your feet. And they have 8, 10, 12, 15 patients at some hospitals. So I consider myself one of the lucky ones. I'm in my specialty. So I have that going for me. So, I'm okay right now. The biggest thing, like I said, is just, the PPE is so hot. It just takes so much more out of you physically each shift, on top of everything else. But it's for our protection, so it won't be compromised. It will be worn. I expect to lose weight while I'm on this, while I'm here. We'll see. So that's all I know now. Wish me luck for tonight. Prayers, and stay safe and stay at home if you can. Thanks.